For many years, health professionals have confirmed that lifestyle choices can have a major impact on the unborn child. Information is widely available about the benefits of healthy food and exercise and why it's advisable for a woman to stop smoking during her pregnancy. These are all ways that a woman who's either pregnant or intending to be pregnant can lessen her risk of bearing a child with a health disorder. But there's another risk which is causing increasing concern for many pediatric professionals, and that's the effect of alcohol on prenatal development. Alcohol is widely consumed across all sectors of New Zealand society, and research shows that alcohol can be directly absorbed by the placenta and have a damaging effect on the unborn baby. Because of factors such as the amount, the timing, and the frequency of exposure to alcohol, it's difficult to predict which children will be more affected than others with the lifelong learning and behavioral difficulties known as fetal alcohol spectrum disorder, or FASD. But the effects of FASD are already so wide-ranging that the disorder has been referred to as an iceberg. What we see on the surface is actually only a small percentage of what really exists. Dr. Valerie McGinn is a child and adolescent neuropsychologist who specializes in the diagnosis and treatment of FASD. And she says that here in New Zealand, up to 4% of the babies born each year could have the disorder. Dr. McGinn spoke with Alan Lee.
All right, well, let's start at the very beginning. What happens when a pregnant woman has a drink during her pregnancy? What actually happens to the fetus?
Well, we know that the brain can be affected structurally in the early stages of the pregnancy before a woman knows that she's pregnant. There are certain parts of the brain forming and the face is forming as well, and this is where we see the full fetal alcohol syndrome, where the brain and face are structurally different. But beyond that, the alcohol continues to damage the brain, and within the first trimester there may be structural problems, or it may be to do with neural pathways that are not forming efficiently. Nearer the end of the pregnancy, if a woman continues to drink, then we have problems with brain growth and connections. So it's quite complicated how a child is affected depending on the dose of alcohol, the way it's the brain's exposed to it. And we do know there's no safe limit of alcohol. We don't know exactly how every person will be affected. Sadly, the damage once done is lifelong, and how that affects the individual's development depends also on the environment that they grow up in, and there's certainly a lot can be done to ameliorate the effects of alcohol. One needs to expose the fetus's brain as little as possible. And of course, in women who are alcoholics or even social drinkers who are not informed in New Zealand about the damage that alcohol causes, they are not going through their pregnancy deliberately harming their child, but they're not aware that alcohol is a huge teratogen that damages brain cells and development.
So we've been talking about fetal alcohol syndrome, but we've got fetal alcohol spectrum disorder. So what's the difference between the two?
Fetal alcohol spectrum disorder is the umbrella term that covers all types of damage that alcohol causes to a baby's development, and fetal alcohol syndrome is the full syndrome when the face is affected, the growth is affected, the brain is damaged, and the alcohol exposure is confirmed. So only probably less than 10% of children with FASD, fetal alcohol spectrum disorder, have the full syndrome where you can see it in the face. But sadly, the rest of them have as much brain damage and difficulties. Alcohol exposure causes such a wide range of problems that often the children are presenting as if they have something else, but in fact what they have is a whole range of neurodevelopmental problems from alcohol exposure. So, many children might be presenting with a bit of autism, with ADHD, with learning problems, and with behaviour problems. And each one of those things is looked at separately and treated, which is fine. However, in fact, what you've got is a much bigger disability, which presents with all these problems, and unless that's recognised, people don't know how to manage it. And so in fact, if they're using the standard treatment for other conditions, then it's being mismanaged.
So many of the things that we hear people talk about is apparently on the increase. So the more children who are diagnosed ADHD, there are more people appearing on the autism spectrum. So those actually may not be that at all. It may actually be FASD.
Absolutely. I mean, what we know is that 60 to 70% of children with FASD have ADHD as part of their brain damage. What we don't know is how many children are diagnosed with ADHD who also have FASD. And we do know that in most developed countries, between 1% and 4% of the population have FASD, and we believe in New Zealand that we're at the high end of that because of our drinking culture.
Let's talk a bit about the drinking culture in New Zealand. You know, it's part of life. We have a beer at the bar, we have a drink at a wedding. It's become part of what being a young New Zealander is all about.
I would say that it's being modelled by older New Zealanders, and it permeates our entire culture.
There's not going to be something that we can change quickly, is it?
No, and we don't expect to change the entire culture. All we want to do is to reduce and hopefully even stop the drinking in pregnancy, and that requires a big effort in terms of warning people that this is dangerous. And you know, what I know from my clinical practice is that, you know, I'm diagnosing children, I'm working with families and mums, and you know, once that mother knows that this is what's wrong with their child, they don't drink in any subsequent pregnancies, nor does any of their aunties or cousins, or it does spread that information into the community, and then people look out to protect their unborn babies. So we need that throughout our society, at schools, on labels, in everywhere. We need that message to go out, and then I think our rates would be greatly decreased.
Did you know that drinking alcohol was worse for your unborn baby than smoking cigarettes, smoking weed, and even smoking pee?
For reals? Did you hear that?
And welcome back to EndZone Focus. Let's rejoin Alan Lee's interview with child and adolescent neuropsychologist Dr. Valerie McGinn about the effects of alcohol on the unborn child.
So let's talk a bit about what happens when they get older. I would guess that once they get to school, that's when things start to get noticed about people on the spectrum. So what happens there?
The primary sort of neurobehavioural problem is that they're immature. So these children are growing up as very many years younger than their chronological age. So at starting school at 5, they are maybe like a 2 or 3 year old, and so they're not prepared. They're not ready for school. And likewise, you know, when they're, say, going from primary school to intermediate school, they may be chronologically 10 or 11, but developmentally 5 or 6. And I think this compounds when their needs are not recognised and met, so that by the time they hit high school, you've got children who are not able to cope, who can't understand what's going on, who can't follow the curriculum, who have compounding problems through failure. And you know, sadly in New Zealand, our young people with fetal alcohol are not growing up confident and learning to their best ability. In Canada, it's a different story. They're getting services. Every child diagnosed gets $12,000 a year towards their education, which means they can have support and they're not facing failure. We have a lot of problem in New Zealand, well, in our practice, with the young adults who are expected at the age of 17 to be independent. And if there's no supports there and they're developmentally 10, then they're being set up for failure, and they're failing sadly, and it's actually dangerous.
So what can happen?
Well, I mean, the statistics are bad. You know, it's not that they're bad people, because they're not. They're actually lovely people. But, you know, when life doesn't go well for them, they can become very unpredictable. They're very vulnerable, and they they behave inappropriately because they have brain damage. And then in the community, they behave inappropriately. So that means they come into contact with the law. They're often easily led by others who are sophisticated, and they're quite simple, or naive is probably a better word. And, the girls get victimised and the boys get victimised.
So do you have any idea of the number of adults who are out there who are undiagnosed with FASD? I wonder how many of our problems in society are actually as a result of that.
Well, if we take, say, 4% of the population as a figure, which I don't think is an overestimate, what we know all we know is what they know from Canada and the States. Now, we know that a recent study in Canada has found 10% of the prison population were diagnosed with FASD, but another 15% had the same problems but couldn't be diagnosed because they couldn't confirm alcohol exposure. We don't diagnose unless we've got confirmed maternal drinking. And of course, if someone's 30 and in a prison, it's quite difficult to track that down. So, I think 25% is a good guesstimate of the prison population. I would say we know that children in care are especially at risk, so their incidence is in the States increased 10 to 15 times. So if we take 4%, we're looking at 40 to 60% of children in care having FASD as an undiagnosed disability. And also their parents, because it's something that is transgenerational. So many parents, I believe, whose kids are in care have not been able to care for their own children because they are alcohol affected themselves and haven't been supported or recognised. So it sort of is I believe, a compounding and huge social problem.
We've talked about educating women about the dangers of drinking alcohol during pregnancy, but do we need to take more drastic steps than that? Do we need to do something about restricting the sale of alcohol?
I think anything that limits our consumption of alcohol across the board, not just women, but everyone, would help the problem. And it's certainly not women drinking alone, by the way. Every woman drinking usually has a man right next to her. It's the whole community and family need to support women of childbearing age not to drink.
As a society, is it the case that we've become too accepting of alcohol and all the problems that go with it? We just let it go?
Absolutely. I mean, I think, there's a whole raft of problems with our alcohol consumption, and, sadly, there were many recommendations made by many good expert people about how our alcohol consumption could be lessened and those problems could be alleviated. And sadly, they haven't been adopted.
Dr. McGinn, thank you very much indeed for your time.
Alan Lee was talking there with child and adolescent specialist Dr. Valerie McGinn about the lifelong learning and behavioural disorders which can result from prenatal exposure to alcohol. And if you'd like more information, here are a couple of websites which could be helpful to you: fan.org.nz and ahw.org.nz. Those websites again are fan.org.nz and ahw.org.nz.